Officials from the Cypress Health Region made a trip up to Anchorage, Alaska last week. They were part of a provincial delegation which traveled up to the Alaskan Health Region. The South Central Health Authority shares many similarities with the Cypress Health Region, including being an area that covers both rural and urban health care. While in Alaska, representatives saw what kind of success the region has been experiencing and contemplated different ways to implement this success in Saskatchewan.
Sometimes we just need to really challenge our perceptions of how we provide health care because we've always done it that way. I think it's important to know that there's models and organizations that have really sort of taken that next step, challenged how we do things, and then really communicated with their communities about what is the most effective health care that can be provided.
And even though there are a number of similarities between the two health regions, there's one big difference in funding, with one being a publicly funded system and another being a privately funded system. But according to the health region, the dollars and cents doesn't seem to make a big difference.
I don't think money's the barrier. Honestly, I think it's how we view our services, having a good understanding of what it is that we really need. They've spent a lot of time working with their patients on personal responsibility for health and what it is that people need to do. So, they've just really tried a number of different strategies that really move to sort of a shared ownership of their health system with the people they serve.
Another aspect of healthcare in Alaska which really impressed upon Cypress Health representatives was their use of telephone and online consultations. And now that they've seen a number of healthcare tools at work, the plan is to start using them.
If we can get our providers excited to work with us, that we have opportunities where we could implement something very similar.
This provincial delegation goes beyond the Cypress Health Region. The Ministry of Health was also there taking notes at the conference and is looking for improvements that can be mirrored province-wide. For Southwest TV News, I'm Kara Repke.